Unwillingness to admit the errors of Obamacare and take corrective action is even throwing America's most vulnerable children who are growing up in poverty circumstances under the bus. They deserve better. Now yield back.
The gentleman yields back. The chair recognizes the gentlewoman from North Carolina, Ms. Fox, for 5 minutes.
Thank you, Mr. Speaker. Thank you, Mr. Chairman. I appreciate the recognition. And I want to give high praise to my colleagues on this side of the aisle who have been here this morning talking about the really, really important issues that are facing our country these days. Why are we here in Washington, D.C. on a Saturday? We should be at home in our districts. You know, Republicans believe that the wisdom of the world is not in Washington, D.C. It is back in our districts. It's back with the American people. But we're here because of a failed policy that was passed without bipartisan support, but strictly on behalf of liberals in this body, in the Senate, and the failed policies of a very liberal president. So we wouldn't have to be here today if it weren't for that failed policy. Unfortunately, our colleagues on the other side of the aisle are trying to put the blame on us for saying that we're here because we're fighting what we see as a failed policy. The American people see it as a failed policy also. The majority of the American people are opposed to what we have come to call Obamacare. It was not passed by bipartisan vote. Our colleagues keep talking about bipartisanship. It was passed purely on a partisan basis. No Republican has ever voted for Obamacare, and every Republican who has had the opportunity to vote against it has voted against it. Why? Because we believe we represent the American people. We don't want to shut down the federal government. In fact, we've passed bills to keep the government running. But we want to have the policy right. My colleague from Connecticut talked about the need for compromise, and he said, erroneously, this is the first time that we would shut down the government over a policy. He must have forgotten that the federal government has shut down 17 times before, sometimes when Democrats were totally in control, sometimes when there was split government, but it's happened 17 times before. What are we doing here on our side of the aisle? We're fighting for the American people. We know this is a failed policy, and we do not want to see this failed policy go any further than it has gone. And as my colleagues have said, the sad thing about it is our president's willing to negotiate with a country that we call a terrorist country, but is not willing to negotiate. He said, what I haven't been willing to negotiate, what I will not negotiate is on the debt ceiling. He doesn't want to negotiate on Obamacare either. But we know that the president did negotiate in August 2011. We know that 5 other presidents have negotiated on this issue. We also know that there are going to be people who are not going to be covered by this program that is supposed to be covering all Americans. And, Mr. Speaker, with that, I would like to put in to the record an article by Daniel Henniger in the September 25th Wall Street Journal called "Let Obamacare Collapse."
Without objection, so ordered.
Because it points out many, many of the problems with this program that haven't all been pointed out this morning. But we have another issue that we're going to be facing in the next few days, and that is the raising of the debt limit. And I want to quote someone who talked about the failure of leadership if we have to face raising the debt limit. I quote, "The fact we're here today to debate raising America's debt limit is a sign of leadership failure. It's a sign the U.S. government can't pay its own bills. It's a sign that we now depend on ongoing financial assistance from foreign countries to finance our government's reckless fiscal policies. Increasing America's debt weakens us domestically and internationally. Leadership means that the buck stops here. Instead, Washington is shifting the burden of bad choices today onto the backs of our children and grandchildren. America has a debt problem and a failure of leadership. Americans deserve better." That was President Barack Obama on the floor of the U.S. Senate, March 20, 2006. Yes, indeed, Mr. President, we have a failure of leadership, and the buck stops with you. I yield back.
Yields back. All members are reminded to address their remarks to the chair, and the chair now recognizes the gentleman from Colorado, Mr. Tipton, for 5 minutes.
Thank you, Mr. Speaker. Let's begin with where we can all agree as Americans. At the very beginning of the debate when it came to health care in 2008, it was about affordability and accessibility when it comes to health care. We can't disagree about that. As Americans, as small businessmen, we felt the pain of seeing ever-increasing premiums, but we also wanted to make sure that we had access to real doctors. What are the results that are now coming out of the Affordable Care Act? Let me give you an example that was just emailed to me last night out of a small community church in my district in Durango, Colorado. They were just able to extend their plan before the Affordable Care Act takes effect. For 6 employees working at the church, their premiums are now going to be $50,665 for the collective group this year. When the Affordable Care Act is going to impact them in the next cycle, those rates will now rise for those same 6 employees to $72,069 for the same employees, a 48.7% increase. So the question we have to ask is, has the Affordable Care Act achieved the goal that as Americans we can all agree that we desire to be able to have? Affordability. Let's talk to those 6 people working in that small church in Durango, Colorado, who are relying on charitable contributions to be able to have their jobs, to be able to have affordable health care. The answer is no. Let's talk to senior citizens that I've visited with throughout the 3rd Congressional District of Colorado, many who just became senior citizens and are now required to sign up for Medicare under the law. Just because of a birthday over the last year or two, they are now finding that they cannot even find a doctor who will accept Medicare. Just held a meeting with better than 20 physicians in Grand Junction, Colorado, several of whom expressed that by the year 2014, they're closing their practices. So have we addressed accessibility in America? We have not. What the administration fails to understand is there's a quantitative difference between affordability and accessibility and just having an insurance card. We can insure every American, but does that mean that you have access to quality health care at an affordable price? The Republican Party is putting forward real solutions to be able to address this challenge. Let's let the free markets actually work. Let's have real competition. Let's allow businesses to be able to come together, to be able to form real groups, to be able to negotiate lower rates. Let's incentivize rather than disincentivize, as the President's law does, those private medical health care savings accounts if we really care about health care. Let's indeed make sure that people with pre-existing conditions have access and affordable health care as well. These are the plans that we are putting forward. But it's going to require that we work together. What is not helpful is when we hear an administration say it is non-negotiable, while at the same time saying we have to work together. We can't work together if we cannot have a dialogue. That is what this House of Representatives is putting forward. Real solutions to be able to address the real problems to help real Americans that are struggling right now. And the bottom line is, if we want health care, we also need jobs. If you talk to the people in my district, small businesses, they aren't able to hire right now simply because of the costs of the Affordable Care Act and the impacts that they're feeling. These are affecting real Americans, real people, and real lives. The solution cannot and should not be just bigger government, just a legacy piece of legislation. I believe that the American people deserve actually a policy that will work for them. That can only be achieved if we work together. We are putting those ideas forward today. We are not about shutting down this government. We want to keep it open. That's the policy of our conference. But we also need to have a policy that's making sure that government laws are not hurting the American people. The Affordable Care Act is hurting the American people, will hurt the economy, will hurt jobs. This is something that we can achieve a positive solution on if the administration will open that door to dialogue rather than distrust. Let's work for the American people rather than for bigger government. And with that, I yield back.
The gentleman yields back. The chair recognizes the gentleman from Florida, Mr. Ross, for 5 minutes.
Thank you, Mr. Speaker. You know, the only thing worse right now than having the implementation of this health care law known as Obamacare on October 1st would be the implementation of this law with special consideration to members of Congress. And some may say, well, that's not going to happen because members of Congress are subjected to and not exempted from Obamacare. And the short answer to that is yes. But the real answer is no. And the real answer is no because there is a state of confusion over whether we, as members of Congress and certain staff members, can continue to receive a 72% contribution to our health care benefits. Now, to understand this, let's go back to how this even became an issue. Senator Grassley, at the time that the Obamacare bill was being debated, wanted to make sure that members of Congress and their staff were subjected to the pains and the ills and everything else of Obamacare. And he offered an amendment that said, notwithstanding any other provision of law, members of Congress and congressional employees would be required to use their employer contribution to purchase coverage through a state-based exchange rather than using the traditional federal employees' health benefits plan. That was offered. What became law is different. The language that became law specifically says that members of Congress and congressional staff, with respect to their service of a member of Congress, shall be health plans that are either created under this act or the exchanges. And then it went on to further say that staff is just considered those that are employed by the staff, by the members of Congress. It doesn't include staff of committee and staff of leadership. Now, why all the confusion? I don't know, but I know for a fact that when the Office of Personnel Management came out with their letter on August 7th and said, without any basis in law or fact, and said, you know what? We're going to let Congress continue to have their 72% contribution, even though the law was clear when it was passed that we are not going to receive anything other than the subsidies allowed under the law, and those subsidies only are available to those who make 400% of poverty level or less. And so we're here on the eve of watching a health care plan go into place when the American public, who has given us, and probably deservingly so, an approval rating in single digits, and say, there they go again. Congress has found a special provision themselves so they will not feel the pain, the economic harm caused by this health care bill. Mr. Speaker, we can correct this. We can stand up as a collegial body, Republican and Democrat, and say, you know what? We believe we need to be subjected to the law 100%, and we think OPM is wrong, and if we want the American public to have what they desperately need to have in this Congress, which is the credibility of this Congress, then we need to pass my amendment to the continuing resolution being offered today that says that this OPM letter was wrong, and that all members of Congress, all staff, the President, the Vice President, all political employees will be subjected to the laws of Obamacare and not receive this contribution because my friends back home will not receive this contribution. We shouldn't carve out a specialty to ourselves. And what's further worse is that if we don't make some change to this law, People will say there'll be a brain drain. No, I see more of a litigation train starting. A litigation train because we've already put in the law special classes of employees. My employees are now subject to the laws of Obamacare, but the employees of staff and the employees of leadership aren't. I see litigation ensuing in employment discrimination cases that are absolutely unnecessary and could be avoided if we have the foresight, if we have the ability to say, America, we're going to correct this. We're going to make sure that we are subject to all the laws 100%, the same way we ask you to be. And so therefore, members, I implore you, please consider this amendment. Consider doing what is right, not only under the law, but in the eyes of our constituency. And with that, Mr. Speaker, I yield back.
The gentleman yields back. The chair recognizes the gentlewoman from Tennessee, Ms. Black, for 5 minutes.
Thank you, Mr. Speaker. In just 3 days, the Obamacare exchanges are set to go live. The security of millions of Americans' most sensitive personal information remains at risk. And for the purposes of enrolling people in the exchanges, the administration is building the largest network of America's personal information ever created, called the Federal Services Data Hub. This data hub will have the names, birth dates, Social Security numbers, taxpayer status, gender, email addresses, telephone numbers of millions of Americans expected to apply for the coverage in the exchanges. This poses an alarming and obvious risk of identity theft and cybersecurity attacks. To date, there has been no independent certification that the information will be kept safe. We are simply supposed to rely on this administration's word that reliable security systems will be in place come October the 1st. This is the same administration that has already failed to meet half of their self-imposed deadlines for the implementations of this disastrous law. Their word is simply not good enough. And this is why 13 attorneys generals, states attorneys generals, have sent a letter to the HHS Secretary Kathleen Sebelius expressing their concerns over whether there is adequate safety measures to protect their constituents' personal data. Making this situation even worse is the Obamacare navigators that are tasked with assessing this information to help people enroll. Now, these navigators are not required by federal government to have background checks or even have a high school diploma, and yet they will be tasked with handling America's most sensitive personal information, such as their medical records and even their tax returns. In fact, earlier this month, a navigator applicant in Minnesota recently received 2,400 Social Security numbers by mistake. This raises serious concerns about the lack of safeguards in place to protect our personal information. Mr. Speaker, we know that Obamacare is simply not ready for prime time, and we cannot allow America's most personal information to be exposed to these threats. It is completely irresponsible for this president to be encouraging people to sign up when these threats exist. The president has already delayed portions of this law to help big business and insurance companies. It is time for him to work with this Congress to stop this train wreck and to shield the American public from widespread fraud and abuse. Thank you, and I yield back.
The gentlewoman yields back. The chair recognizes the gentleman from Texas, Mr. Poe, for 5 minutes.
Thank you, Mr. Speaker. I posted on my Facebook the question, how has Obamacare affected you, or will it affect you in the future? I received almost 400 responses. I will just read a few of those, and I certainly won't read the ones that were volatile, Mr. Speaker, because a lot of people are just mad. It is true that about 20% of those responses like Obamacare, and about 80% not so much. Lisa says, my son was lowered to 29 hours last week for a new full-time norm because the owner doesn't want to pay Obamacare. Sharon says this, my mother is a diabetic and couldn't take insulin for 3 days because she couldn't get her test strip prescription filled due to a glitch in Obamacare. Christy, my hard-working husband can only find temporary contract work. No one wants to hire permanent positions, and those that do have permanent positions are hard to even get an interview with. I hope it doesn't last long. We have a baby due in mid-October and already 3 children. Joseph, I expect my employer will not be able to afford future raises due to the enormous expense he has to pay under Obamacare. Victoria, my husband has not been able to get a job because folks are not hiring due to Obamacare. They are actually laying people off. My parents are elderly, and they have 3 doctors who have quit medicine because of Obamacare. So no, Mr. Poe, it is not the greatest thing ever. April, she says this, since the implementation of Obamacare, I have not been able to find a job. No one wants to hire a permanent position. Everything is part-time or temporary for all those jobs. And they also tell me that I'm overqualified. I think the whole Obamacare thing needs to be done away with. Janelle says, my husband and I are in our 70s. Our co-pays for prescriptions have doubled. Our doctor told us that he will not be able to treat us with the same quality we now get when Obamacare goes into full steam. Mary Lou probably said it the best. She said, Ted, we pray even more fervently that we just don't get sick. Now, those are some responses of people out there who actually work for a living and are concerned about health care, and they're not so sold on this. So here we are on this Saturday afternoon, and the President is spending time negotiating with the Iranians about things in Iran. He's spending time negotiating with the Russians about things that are going on in Syria. But he won't negotiate with Congress. I don't get that. Why doesn't he come over here to the House? Let's sit down on an informal basis and just chat about the problems we have. The idea the people in Syria and Russia and Iran are more important to talk with than members of Congress? I don't get it. Obamacare, we just don't want to get sick. And now today we're facing a debt ceiling problem. We're facing continuing to fund the federal government problem. We have Obamacare that gives special treatment for about 1,200 groups that got waivers. None of these people got waivers. Let's talk about those things. Let's find out, and maybe we can work out something, but let's at least talk. So, Mr. Speaker, you're in good with the President. Give him a phone call. Ask him to come over here and chat this afternoon with the House, the Democrats, the Republicans, and let's work something out about the continuing resolution, about the debt ceiling, but at least let's talk and negotiate and not refuse to talk to even members of the House of Representatives. And that's just the way it is. I yield back.
The gentleman yields back. The chair recognizes the gentleman from Florida, Mr. Mica, for 2.5 minutes.
Well, thank you, Mr. Speaker and my colleagues. Saturday morning, and we're here in the House of Representatives in an unusual session. I've had some people had the opportunity to go home last night and come back this morning. Some people said, oh, this is an unusual duty and you're working hard and all of that. And I said to them, listen, I represent millions of people across the United States who are going to work. They go to work sometimes at midnight, work all night. They get up in the morning, go to work at 6 o'clock. They're struggling to put food on the table. They're struggling to educate their children. They're struggling to pay their mortgage and keep their home and their family together. So I believe that it's Congress's responsibility, and there's no question about it, that we work. That we work on Saturday, we work on Sunday, we work on Monday, we work until we get this situation resolved. Now, where are we? We are at a crossroads. Rarely in the history of our nation have we come to a crossroads like this. We have the biggest government program probably since World War II in Obamacare and the President's health care plan going into effect in a few days. We have the government running out of money in a few days on October 1st. And then we have the country facing a financial deficit in less than 2 weeks. So this is an important crossroads, and we need to get it right because there are a lot of hard-working Americans counting on us. We must avoid the biggest government takeover of health care or any segment of our economy in history. We must avoid forcing people into part-time employment, the government making decisions about our health care. Even the unions are walking away from this plan now. We have a short time to accomplish that. The deficit, now listen to this, $17 trillion, and they want to extend it almost another trillion, $900 billion for 1 year. Since the beginning of the Obama administration, in 5 years, we've gone from $9 to $17 trillion in debt, almost doubling it. And finally, funding government. We must keep the government open. We must be responsible stewards to the public. But the spending spree in Washington has to stop. Republicans have held the line. We need to hold the line responsibly. We can cut waste. We can cut inefficiencies, and we can make government accountable to the people. With that, Mr. Speaker, I yield back the balance of my time.
The gentleman's time has expired. Pursuant to Clause 12A of Rule 1, the Chair declares the House in recess until noon today.
And over the weekend, the House expected to be in and out of session. They'll be working on that bill sent to them by the Senate to fund the federal government through November 15th without defunding the health care law. They're holding off-the-floor meetings throughout the day. House Republicans expected to meet in about half an hour, 12 o'clock Eastern time, to work on the bill that was passed by the Senate yesterday. That Senate bill was along straight party lines. It passed 54 to 44. 2 Republican senators were absent and didn't vote. Some tweets coming from members. Martha Roby of Alabama